Now, let's look at some of the notable policies that Dr. Bawumia introduced, or is still, well, I can't say introduced because he's still the vice president of the country. So it's still ongoing. Yes. We will start with the Zipline drones. Yes. How has that been impactful ever since it was introduced?
Okay, so the initial announcement and partnership implementation launch in April 2019. Officially, or Ghana officially, so let's say the NPP was the government in power. So officially, Ghana launched the Zipline drone delivery services. Yeah. Now, when it comes to impact and benefit, let me just take 4 key things that in our health sector had always been a challenge that the Zipline has addressed. Yeah. So let's talk about healthcare accessibility. When you emphasize on specific things that we are using the Zipline drone delivery system for, let's talk about blood. It is a necessary requirement when you are having a surgery. You need to have a certain pint of blood on standby for every surgery. Yeah. And for me, the most important and crucial aspect of the surgeries is when we are talking about childbirth. A lot of people take childbirth, no. Let's talk about the emergency situations. When you go into an emergency surgery during childbirth, that is where we realize that our system used to get short of blood most. And if you've done any research on maternal death, almost 60 to 70% of it was due to shortage of blood or unavailability of blood. So if you get a drone delivery system that delivers blood when you need it, it's an accessibility point. You've made it accessible for people so that they can get it when they need it. Not that it arrives after they need it. As per, or let's compare that to traveling with blood across different, using different means by road or whatever it is. If we also think of the cost efficiency in this, let's talk about even us as individuals when you want to purchase an airline ticket to travel from Accra to Kumasi and you have to deliver blood. Now, first of all, you don't even have the condition. How are you even going to take the right conditions? How safe how can you even guarantee the safety and the hygienic of you handling it? But in the emergency, it may occur to you that why don't I just go by flight and take it and then, and then it is. So let's talk about the efficiency, the timely delivery, the efficiency. So we've improved accessibility. We've made it cost efficient because using the drone is cheaper than us having to convey blood because of the circumstances under which you would have to then convey it. And then let's talk about another thing about the issues of the medication also going by drones. Remote areas. So today we've made accessibility beyond the normal urban and big hospital areas where you would find these things in an emergency. You now can reach even more remote areas. So the challenges in the healthcare system, a lot of it, emergency response, which means accessibility, timely response, cost efficiency, and the hygienic way in which we're handling both medication and blood, we have overcome a lot of these challenges with the drone delivery system. So for me, I think this is one of the best answers to these specific challenges that we were facing in our healthcare delivery system.
And are we looking at broadening